Welcome to PCOM Perspectives, where we discuss news, events, research, and other topics impacting our campuses and communities. Join us as we share our PCOM perspectives. Hello, and thank you for joining us. I'm your host, Dr. Jay Feldstein, and today we're talking with Dr. Marla Golden, Dean of Osteopathic Medicine at PCOM South Georgia in Moultrie. A 1988 graduate of PCOM, she has served the college in various administrative and faculty positions since 2010. Dr. Golden began as a preceptor for PCOM students in her integrative pain medicine practice, where she taught students how to use the osteopathic approach, including manipulative treatment, to help patients deal with chronic pain issues. Dr. Golden's administrative career at PCOM began as a regional assistant dean for PCOM Georgia. This role required her to develop relationships with partners in Northeast Florida and South Georgia. She created a clinical anchor site for students in Jacksonville, Florida, and oversaw other anchor sites in Northeast Florida. Dr. Golden served in an interim role before becoming chair of clinical education for PCOM South Georgia. She recently transitioned from the Associate Dean of Clinical Education to Dean of the Osteopathic Medicine Program at PCOM South Georgia. Welcome, Dr. Golden.
Hi, thank you.
So, Marla, I've got a couple questions for you.
Okay.
First, congratulations on being named Dean of the Osteopathic Medical Program at PCOM South Georgia. So we opened our Moultrie location in the fall of 2019 and graduated our first class of DOs in May of 2023. What makes South Georgia and the region a unique area and Moultrie the ideal location for a rural osteopathic medical school?
Well, you actually mentioned one of them, but first and foremost, it's really a wonderful part of a wonderful state. South Georgia is delightful. As you know, there's big agricultural industry here that supplies our country with so many things, from cotton for our textile industry to peanuts and vegetables and much more. That makes us very rural, the entire South Georgia region. It translates to being somewhat underserved when you take into consideration the large pieces of property and how spread out the population is, and that coupled with the shortage of physicians in rural areas creates that underserved population. It's also a very diverse population, and so it's a very unique area, as you stated, and one that's perfect for an osteopathic medical school because we need physicians in our country, and especially in the rural South. Keeping with the mission of osteopathic medicine to provide primary care to patients in those areas, I feel like this is a great alignment. To go beyond that, we also address the diverse population of the people here. PCOM South Georgia is admitting and training a diverse population of students from the South to stay in the South and provide that quality medical care to a diverse population of patients. You ask about Moultrie specifically. From my standpoint, one of the biggest reasons I believe is that we had a relationship established with the Moultrie medical community that preceded my work as the Associate Dean of Clinical Education. Students were coming to Colquitt Regional Medical Center. They were very happy here. They loved their learning opportunities. And I think as the opportunities grew and the community and the leadership at Colquitt Regional came to understand that we were so aligned in our missions that it just made sense to talk about creating a school or putting a school in this town and in this location. It's also very well placed with regard to the whole South Georgia area and the other healthcare systems, if you will.
Great answer. So
Thanks.
Many students and faculty have mentioned the family atmosphere that exists at PCOM South Georgia. How does that benefit the students?
Oh, it's a huge benefit. We have a small campus, but it's just lovely. When I think of a family atmosphere, I think of a place where we can be ourselves. It's a comforting, safe place where students can grow with encouragement from people who truly care. And that's a great learning environment when they can relax and really take their time and be supported along their path. I had a very touching moment last week when I was leaving campus at a kind of late evening hour. One of our custodial employees said, "It's okay, Dr. Golden, you can go home and get some rest. We'll be here with the students that stay late. We know them all by name and we watch over them." It was very sweet and very kind, and it's true. So to be in that kind of an environment, I think, is a very positive perspective for learning.
So what are some of the initiatives you have planned for PCOM South Georgia?
Oh, how much time do you have?
A little bit of time.
I'm just kidding.
I know.
Right off the bat, I really did think about how, as medical educators, we could provide a dimension of education to the community just doing what we do. And the two things that came to mind very quickly were our culinary elective, where our students learn about nutrition and healthy foods and how to prepare them, as well as our addictions elective. We all know the problems with substance abuse and tragic overdose deaths and all of the issues surrounding people with substance use disorders. We have an addictions elective, we have a culinary elective. Why not bring some community members in with their children from middle school or high school and have them learn about these two very important aspects of life while we're doing it? We're already doing it, so why not bring them in? My only ask and hope would be that then these people, these students, these parents can take it back to their churches, their schools, their communities, and really grow this healthcare literacy approach, if you will, grow the understanding of the importance of health and wellness, but also knowing how to do that, how to be healthy, how to be well. We have lots of other thoughts. I'm really excited. One of the things I identified in my first 90-day talk was that we were going to create a group of brainstormers. The first brainstormers meeting is April 8th. We're going to have members of each of our departments and faculty and staff, as well as some student representatives in the room to talk about those two initiatives and many others. I think they're going to come up with some really great ones. And then our hope is that we will hold a summit with community leaders, law enforcement, organizations involved in education, as well as local schools and colleges, if I didn't already say that, and some of the very active civic groups in our region to see which initiative makes sense to them and where they might like to get involved in a work group so that we can all come together and raise it up.
With PCOM South Georgia being the newest of our campus locations, this spring will be the second commencement and on Friday, the second match day. Can you talk about the significance of events like these, particularly in the life of a medical student, specifically in South Georgia and as a milestone for the campus as well?
Absolutely. We are excited about match day. I'm not sure who's more excited. I think it's probably the students. One of the best days in the life of a fourth-year medical student is match day, where they find out where they're going to spend their residency training, where they're going to learn about their specialty of choice and become expert in that field. It's a lot of anxiety, a lot of excitement, but it's hope for the future. It represents their next step. And so it's really a great day, second only to graduation, I think, when they finally get to walk across that stage. We're really thrilled that it seems that we're accomplishing our mission here. We have GME opportunities that are growing locally at our partner institutions, and our students are matching into those programs. And so we're doing our job. We're training those physicians and we're putting them back out into the same communities where they've trained. So it's a great day. It's a great time to see this evolve. It's only our second class, but we hope to see many more.
So I'm sure you got a couple of questions for me.
I do. I do. I'm a curious person, so I think a lot about how things came about and evolved with PCOM from the time that I left as a graduating student and the time that I came back. And I think about the challenges of having two additional colleges in another state?
Just from a pure numbers perspective, whether it's a business, a university, whatever it is, whenever you have more than one location, you just have inherent challenges.
Sure.
And a lot of times I equate it to having children. When you have your first child or the oldest, there's a certain expectation that child sees the world a certain way. Well, when you have your second child, that now you've got the baby. Well, the baby sees the world a certain way, and the older child sees the world a certain way. And then when you have your third child, now you've got the oldest, the middle, and the baby. So everybody feels that they're, who does mommy and daddy love more? Right? So you get into these issues regardless of the industry of, are we getting the right resources? Are we getting the right attention? How come this is here? How come that's there? So that's part one. And part two, quite frankly, is the challenge. You couldn't have more, I would say, two different cultures. Swanee's North Atlanta, pretty much metropolitan, but still the South. And when you go to Moultrie, you're in the deep South, which is quite a different culture from Philadelphia. So we've got different cultures that we've got to assimilate and understand. But those are great opportunities and, challenges that I think over the past 20 years, we've been rather successful in melding and putting all that together.
That's great. I love that analogy of the children. So I guess I'm the baby.
I guess you're the baby.
That's very funny. So what kinds of changes did PCOM have to make to support this kind of growth?
Well, I think one that you've lived through and was probably, from my perspective, the most significant was the PCOM1 curriculum for the DO program. And and to really build a culture that, okay, we're 3 locations, there may be different parts of the country, different cultures, but they've got one goal. And that's to turn out highly qualified physicians, physician's assistant, whatever the program is, because we are one brand. And we owe it to our clinical partners, and we owe it to the patients that our students are going to care for, that no matter where you go to PCOM, you're getting the same quality physician, the same undergraduate medical education training, and the same opportunity for great postgraduate medical education training. So to me, that's been the most significant. And I think from a management standpoint, trying to put leaders, key leaders that are responsible for all 3 locations in different locations. So it's not all Philadelphia centric. And I think we've done a pretty good job of that, and we'll continue to do that as well.
Thanks. I would agree. PCOM1 has been a great initiative because if we're PCOM, we're PCOM. And I think that comes through. It also allows us to tap into all that talent at 3 different institutions, and that makes us stronger and better every day. So thank you. And last but not least, what do you think are the biggest challenges facing osteopathic medicine in the 21st century, and maybe specifically in the state of Georgia?
How much time do we have?
I'll say the same thing you did.
So, okay. I think, I'll take it one step further. The first is the challenges medicine's going to face. So that's first. I mean, with, evolving technologies, therapies, workforce development, that's a challenge. How do we grow a physician workforce and a healthcare workforce, whether it be physician's assistants, behavioral health specialists? How do we kind of integrate the world of AI and genomics and rapidly changing pharmaceuticals and care delivery models into a health education and workforce projection? So that's first. Second, osteopathic medicine, we hang our hat on primary care, but that's not going to be good enough going forward. We got to afford our students the opportunity to be competitive in any specialty they want to be in. And so, even though if you want to be a specialist, you're still trained in the osteopathic principles of
That's right.
holistic care. Because, osteopathic medicine and even allopathic medicine in the primary care space, we're being outnumbered by nurse practitioners and physician's assistants. They
Mhm.
get into practice basically 4 years undergraduate degree and 26 months of training, and they're out. We're 4 years of 4 years of undergraduate school, 4 years of medical school, and for primary care, 3 years of residency. So that's 11 years versus 6. So just from a sheer numbers perspective, we're going to have increased competition
Mhm.
just by pure numbers. I'm not even getting into levels of quality of care or whatever. So we just got to make sure we're in a position that we're offering value to lead teams of care so that we
Yes.
continue to be, the leader and actually be in control of healthcare. So that's osteopathic. And then the state of Georgia, we're still a minority, even though we've been there 20 years. I feel like Rodney Dangerfield, we're trying, can't get any respect,
Yeah.
and we struggle from a legislative perspective to get the kind of support that our competing Georgia-based schools get, so that at the end of the day, they're disadvantaging their own Georgia residents from a financial support perspective, because our Georgia students aren't getting that level of state support, which increases their debt burden.
Yes.
So,
I would
and
agree.
there's just not enough of us yet in the state. We're doing a great job. We're turning out more osteopathic physicians that do their residencies in Georgia and stay in Georgia. And hopefully they'll get to leadership positions that'll help continue to drive our growth there.
Absolutely. I think it always comes down to education and awareness, right? We're
Right.
still out there helping people understand what a DO is. And to your point, it's not just a physician who does osteopathic manipulative treatments. It is a physician who is trained and brings those osteopathic principles in practice to any practice and any specialty that they are in. So I think maintaining that and keeping up the charge, we should be okay, but we definitely have our challenges, don't we?
Yeah, and that's what keeps it interesting and fun.
It gives us something to do.
Yeah. So, Marla, I want to thank you for joining us today. As PCOM's presence in South Georgia continues to expand, we're ensuring the future of medical education and helping to meet the critical demand for physicians in the region. With dynamic leaders such as yourself leading the way and a tremendously supportive community cheering us on, PCOM South Georgia will continue to be a source of pride for the PCOM community and a key contributor to our mission. I'm Dr. Jay Feldstein, and this has been PCOM Perspectives. You can listen to PCOM Perspectives on Spotify or wherever you get your podcasts. Until our next episode, remember, as you navigate the fascinating worlds of medicine and higher education, shifting your outlook can be the key to unlocking new insights and better patient care. Stay curious, stay open, and keep a healthy perspective.